Now, in the previous video, I explained briefly regarding knee osteoarthritis. So in this video, I'm going to talk about the stages of osteoarthritis, the knee osteoarthritis. And if you'd like to watch this video in Bahasa or Chinese or Tamil subtitle, just click on the captions options available. Now, knee osteoarthritis, we grade them into grade 1 to grade 4. Now, in order to grade this, we need to have a standing x-ray. A standing x-ray will accentuate the reduction in the joint space in the early stages of the osteoarthritis, and it's always advisable to have a comparable x-ray on the opposite side so to understand the pathology further. Now, in stage 1 is what we call as a suspicious reduction in the joint space. Now, when we typically see a knee x-ray, we will see the thigh bone and the leg bone, and you will see a space in between. Now, this space is not an empty space, it has actually cartilage and meniscus, and what happens in knee osteoarthritis is that the cartilage becomes thinner and thinner, thereby you will see a reduction in the joint space. So in grade 1, it is just suspicious. Now, what we advise at this point of time is to do physiotherapy, take some medication on and off, and make sure whatever activities you are doing it properly. You might be involved in certain sport activities that might not be the most optimal way of doing it, thereby leading to a lot of injuries, and you will accumulate these injuries, and this will make your symptoms severe. In grade 2, there is a definitive reduction in the joint space. This is the time where you might notice that there might be certain limitation in your activity. Probably you play sports and you need to take a break for a longer period of time to recover. This is the stage where you still need to do physiotherapy, you still need to depend on your medication, and maybe when all this is not really controlled well, an injection would help. In grade 3, with the definitive reduction in joint space, you will see a lot of new bone formation. Basically, the new bone formation is there because of the uneven stress distribution, and you will see that your symptoms become more worse. You are more dependent on the medication, and then you might have a lot of limitation in the usual activity that you do, thereby you are usually limiting yourself from doing the usual activity. And grade 4 is when there is an obvious deformity, where we will see that as the space in the medial side gets thinner and thinner, your knee starts to bend inwards. And this is the final stage where usually surgery is warranted. In the next video, I'll be focused on how we treat each of these stages so that the outcome is better for the patient. So stay tuned for that.